I want to take a moment to talk about the skeleton on the sagittal midline view, since everybody gets a sagittal midline view for brain MR. We've got the diploic space, which has variable amounts of fat in it, especially in the midline, where it's pretty much devoid of fat, as you frequently volume average the sagittal suture. And the sutural volume averaging can produce this little dotted appearance. I'll make it a little lighter so you can see it, of the diploic space. You've got an inner table, an outer table, and then the galea, which is visible inferiorly, but superiorly it hugs the outer table, so it's hard to separate out the galea unless it's lifted off by a subgaleal hematoma. Here is the superficial fascia of the scalp. There's the skin, and here's some subcutaneous fat. Then we have the tip of the basion and the tip of the opistheon, which define the foramen magnum. Then we've got the anterior button of C1, the atlantodental interval, which we pay careful attention to in rheumatoid arthritis, and the tip of C2. And there are some membranous and ligamentous structures we'll tackle in the cervical spine talk and vignette. We've got the anterior arch of C1 as mentioned, and the posterior arch of C1, the posterior arch of C2. Don't forget to look at the sphenoid sinus and the frontal sinus. The clivus is a particular area of consternation. You can have synchondroses here. You can have bone islands here. You can even have recruitment of red marrow in this flat bone structure, and sometimes that may produce some consternation when you're considering the diagnosis of metastatic disease. However, typically, red marrow fades or becomes less bright on the T2 weighted image, and when you inject it and do first-pass imaging or delayed contrast imaging, the enhancement is little to scant, and that will help you differentiate it from something of importance or significance. We're going to tackle in its entirety the brainstem skeletal anatomy in another series of vignettes. Pomerantz out.